Shall I? I think we are ministers here. He's sitting. You need to unmute yourself. Yes, ministers here, so you can begin.
Your Excellencies, distinguished colleagues, partners, and friends, I am Dr. Teresa Cassava, Director of the WHO Global Tuberculosis Program, and I am very pleased to welcome you to this important side event co-organized by WHO and by the Russian Federation. This event marks exactly 2 years this week to the UN high-level meeting on TB held in New York in 2018 that brought together heads of states, partners, donors, civil society representatives. This continues the spotlight on ending TB that has been burning since the successful WHO Global Ministerial Conference on ending TB in Moscow. 2020 has been a sobering year for us so far as the world grapples with the COVID-19 pandemic. However, it also marks a midpoint of efforts to accelerate the TB response to reach the 2022 targets promised by countries in the UN high-level meeting political declaration. As requested in the political declaration, a 2020 progress report of the UN Secretary General to the General Assembly has been developed with the support of the WHO Director General. This will be released in the coming weeks. The aim of today's event is to attract once again high-level attention to TB, to discuss how we can collectively implement the recommendations outlined in the 2020 progress report of the UN Secretary General, to advance multisectoral action and accelerate progress to reach the 2022 targets of the UN political declaration on TB. A spotlight will also be placed on the impact of the COVID-19 pandemic on progress towards ending TB. Dear colleagues, we have a distinguished line-up of speakers today, including from WHO and UN leadership, national ministerial delegations, partners, and civil society, all who are invested in the same cause of wiping out this top infectious killer. Please note, translations are available in English and Russian. Thanks to our audience who have joined today. We had over 1,100 registrations for this event. It will be live streamed on UNTB and posted on WHO website. We also welcome questions. This will be curated for use at the Q&A session at the end time permitting. Now, please let me start by inviting the co-host and co-chairs of the event to deliver the opening addresses. We are very pleased to have Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, join us in delivering the opening address. Thank you, Dr. Tedros, for your commitment and dedication towards ending TB, and we appreciate your time despite your heavy schedule around COVID-19 and beyond. Floor is yours.
Thank you, Dr. Teresa. Spasiba большое. Your Excellency, Mikhail Murashko, Minister of Health of the Russian Federation, Deputy Secretary General Amina Mohammed, Excellencies, distinguished guests, dear colleagues and friends. 2 years ago, the nations of the world gathered for the first United Nations high-level meeting on TB. Heads of state and other leaders made bold commitments to accelerate the response to end the world's top infectious killer. These commitments have offered hope for ending the death and suffering of millions worldwide who are struggling with TB, a preventable and treatable disease. The 2020 progress report of the UN Secretary General to the General Assembly on ending TB, developed with WHO support, comes at a critical time. The report provides an opportunity to reflect on progress made in the fight against TB, but also to highlight the risks that threaten to erode the gains we have made. There is good news. The number of people treated for TB has grown since the UN high-level meeting, with over 14 million people reached with TB care. The number of people provided with TB preventative treatment has increased 4 times, from 1 million in 2015 to over 4 million in 2019. These are impressive achievements that we must celebrate. However, equitable access to quality and timely diagnosis, prevention, treatment, and care remains a challenge. Accelerated action is urgently needed worldwide if we're to meet our targets by 2022. The COVID-19 pandemic threatens to unwind the gains we have made. The impact of the pandemic on TB services has been severe. Data collated by WHO from over 200 countries show sharp drops in TB notifications. Our modeling suggests that a 50% drop in TB case detection over 3 months could result in nearly 400,000 additional TB deaths this year alone. In response, WHO is working in close coordination with our partners and civil society to support countries in maintaining continuity of essential health services, including for TB. COVID-19 is demonstrating that health is not only an outcome of development, it is a prerequisite for social, economic, and political stability. Although the pandemic is a setback to our efforts to achieve the Sustainable Development Goals, we cannot allow it to become an excuse. We must use it as motivation and increase our resolve. We're all accountable for delivering on the commitments we have made. But none of us can meet those commitments alone. We can only do it together. We need all hands on deck. That's why WHO has developed and adapted the global strategy for TB research and innovation, the multisectoral accountability framework for TB, and updated our TB policies and guidelines. WHO is supporting countries to adapt and use these tools to translate commitments into actions and to monitor, report, and review progress with the engagement of high-level leadership, all relevant sectors, civil society, and other stakeholders. We're encouraged to see high-level leadership on multisectoral accountability in several countries, including India, Indonesia, Pakistan, the Philippines, the Russian Federation, and Vietnam. In all, 86 countries have reported having a national multisectoral accountability mechanism in place with high-level leadership. But ending TB is not just a job for governments. Everyone has a role to play, from the corridors of power to the villages and streets where people live and die with TB. To make sure everyone's voice is heard, WHO established the WHO Civil Society Task Force 2 years ago, following the very successful Global Ministerial Conference on Ending TB in Moscow. When we listen to the voices of people and communities affected by TB, we're reminded that ending TB is not just about ensuring access to health services, it's also about defending human rights. As you know, TB is deeply rooted in populations where human rights and dignity are threatened. While anyone can fall ill with TB, the disease thrives on the most vulnerable. That's why efforts to end TB must go hand in hand with other efforts to reduce inequalities, eliminate extreme poverty, ensure social protection, and achieve universal health coverage. Excellencies, dear colleagues and friends, thank you all for your commitment to ending TB, and especially to the Russian Federation for your ongoing commitment to this global health priority. I'm proud to stand with you today. COVID has taken so much from us, but nothing can take away our shared vision to end TB. Together, we will make that vision a reality. I thank you.
Thank you very much, Dr. Tedros, for your inspiring words. I would like now to invite the Honorable Health Minister of the Russian Federation, Dr. Mikhail Murashko, to deliver the next opening address. As it was told, the Russian Federation hosted the first WHO Ministerial Conference opened by His Excellency President Putin with strong commitments towards ending TB. Russian Federation, although a high-burden country, is also one fast-tracking progress. Please, Dr. Murashko, floor is yours.
Добрый день, уважаемый господин генеральный директор, уважаемые коллеги. От Министерства здравоохранения и Российской Федерации от себя лично рад приветствовать всех на сегодняшнем заседании. Хочу отметить, что вчера, выступая, президент Путин подчеркнул высокую приверженность и подчеркнул заслуги Всемирной организации здравоохранения в борьбе за здоровье населения всего мира. Хочу отметить, что сегодня мероприятие проходит в условиях продолжающейся пандемии COVID-19, на борьбу с которой брошены усилия стран и Всемирной организации здравоохранения. В эту трудную минуту выражаю признательность медицинскому сообществу за усилия, предпринятые для борьбы с новой коронавирусной инфекцией и другими инфекционными заболеваниями, такими как туберкулез. Туберкулез и по настоящее время остается основной причиной смерти в мире среди инфекционных заболеваний многих стран и уносит ежегодно до 1,5 миллиона жизней. И сегодня риск роста заболеваемости и смертности от туберкулеза увеличивается по прогнозам Всемирной организации здравоохранения. Хочу также сказать, что в этот период борьбы с коронавирусной инфекцией, когда большое количество граждан разных стран получают диагностику с помощью компьютерной томографии, рентгеновских исследований, стали широко в нашей стране применяться методы искусственного интеллекта для анализа снимков. И это позволяет увеличивать выявляемость не только поражения легких при COVID-19, но и многие другие заболевания, включая туберкулез и злокачественное поражение легких. В последние годы страны мира при лидерстве ВОЗ и в тесном взаимодействии с партнерами заявили сначала на первой Московской министерской конференции по туберкулезу, потом на первом заседании высокого уровня по туберкулезу Генеральной Ассамблеи ООН в 2018 году о необходимости усиления мер по борьбе с туберкулезом для достижения целей устойчивого развития по ликвидации туберкулеза к 2030 году и добились успехов по многим направлениям. В последние годы Россия демонстрирует один из самых впечатляющих темпов снижения заболеваемости и смертности от туберкулеза в мире, что является фактом, признанным Всемирной организацией здравоохранения. Так, число заболевших за последние 10 лет снизилось более чем в 2 раза, а умерших от туберкулеза более чем в 4 раза, что является результатом широкого комплекса мер, финансовых, стратегических, организационных, базирующихся на приоритетном отношении государства к проблеме туберкулеза. Благодаря этому мы входим в число 7 стран, которые добились значительных успехов и находятся на пути к достижению целей стратегии Всемирной организации здравоохранения по борьбе с туберкулезом. Вместе с тем, пандемия нового коронавируса может оказать негативное влияние на существующий прогресс всех без исключения стран. Поэтому необходимо приложить дополнительные усилия по сохранению наших достижений. И несмотря на позитивную тенденцию, в эпидемической ситуации по туберкулезу мы сталкиваемся с рядом проблем, которые могут создать сложности к радикальному снижению бремени туберкулеза. Россия, как и во всем мире, все большую роль играет множественная лекарственная устойчивость. В настоящее время каждый третий больной туберкулезом в России имеет резистентность возбудителя и к ряду препаратам, что представляет значительные сложности для подбора терапии. Однако при раннем выявлении резистентности возбудителя, соблюдении современных принципов непрерывного лечения, назначение новых высокоэффективных схем терапии в комплексе с другими методами лечения, в том числе хирургическими, лекарственно устойчивый туберкулез становится излечимым. Туберкулез у лиц, живущих с ВИЧ, является еще одной проблемой, затрудняющих проведение противотуберкулезных мероприятий в связи с более агрессивным развитием заболевания на фоне иммунодефицита. В соответствии с рекомендациями Всемирной организации здравоохранения и Российского общества фтизиатров в стране проводятся специальные профилактические мероприятия по туберкулезу у лиц, живущих с ВИЧ-инфекцией, такие как химиопрофилактика, регулярное обследование на туберкулез. Уважаемые коллеги, особенностями организации противотуберкулезных мероприятий в России является сеть специализированных противотуберкулезных диспансеров, четкая нормативная база, регулирующая деятельность специалистов, доступность современных методов диагностики, лечения и в том числе покрывающих расходы за счет средств государства. Активно используются цифровые технологии, в том числе использование больших данных, создание федерального регистра больных туберкулезом, который в режиме реального времени может представлять данные о каждом больном, прогнозировать эпидемиологическую обстановку и служит инструментом для организации персонифицированного и бесперебойного обеспечения лекарственными препаратами. Позволяет автоматизировать в том числе статистическую информацию по туберкулезу и оценивать эффективность. Это то, что сегодня называется анализом больших данных. Противотуберкулезные мероприятия в России проводятся при поддержке правительства и включают в себя комплекс медицинских и немедицинских мер, такие как социальная поддержка больных туберкулезом, сохранение места работы, оплачиваемый больничный лист, льготные пенсии по инвалидности, в том числе предоставление жилья, а также бесплатное лекарственное обеспечение из федерального бюджета и региональных бюджетов. Также используется и санаторно-курортное лечение и реабилитация. За долгие годы работы мы уже накопили значительный опыт в борьбе с туберкулезом, который может быть ценным для других стран, для которых вопрос туберкулеза составляет проблему. В связи с пандемией новой коронавирусной инфекции COVID-19 ВОЗ прогнозирует рост заболеваемости и смертности от туберкулеза. И мы, понимая важность, должны приложить усилия для того, чтобы не допустить возврата подъема заболеваемости туберкулезом и сохранить позитивный тренд в контроле за этой грозной инфекцией. Только совместными усилиями мы сможем добиться устойчивого снижения заболеваемости туберкулезом в это непростое время. Хотел бы поблагодарить коллег из стран БРИКС за развитие научного сотрудничества в рамках созданной в сентябре 2017 года сети по исследованию туберкулеза, которая является дискуссионной площадкой для обмена лучшими практиками, опытом и достижениями и стала центром межстранового взаимодействия. В заключении позвольте выразить признательность странам, программам и агентствам ООН и представителям неправительственных организаций за участие в сегодняшнем мероприятии, а также выразить особую благодарность генеральному директору, доктору Тедросу за успешную координацию работы и активное вовлечение в дело борьбы с туберкулезом. Благодарю вас за внимание.
Is also chair of the United Nations Sustainable Development Group. She has been a passionate advocate for TB and been part of both the UN high-level meeting on TB and the Global Ministerial Conference. Please.
Excellencies, ladies and gentlemen, just a few years ago, the end of the TB epidemic was seen as a distant aspiration. But political support at the highest level has brought the goal of ending TB much closer. There's been significant progress since the UN high-level meeting on TB in 2018. Yet today, the COVID-19 crisis threatens to reverse those gains. TB remains the world's top infectious killer, claiming millions of lives each year. We need to urgently step up the response to end the suffering and deaths caused by this preventable and curable disease. To tackle TB, we must face the social drivers of the disease. We must work across sectors and link our efforts to the broader global health agenda, including to achieve universal health coverage and to the Sustainable Development Agenda. Tuberculosis provides a critical opportunity to build a health infrastructure capable of not only preventing, diagnosing, and treating TB, but of promoting and protecting the broader health and well-being of entire communities. We've seen this in action during the COVID-19 pandemic, with national TB programs and systems leveraging support to the COVID-19 response. We are midway towards reaching the 2022 targets outlined in the political declaration of the UN high-level meeting. Inclusive and ambitious partnerships will be critical across ministries, agencies, civil society, and stakeholders from both the public and private sectors. And leadership will be an absolute imperative. The United Nations stands firmly behind you as we strive to fulfill our common vision of ending TB. Thank you.
I would like now to invite Mrs. Blissina Kumar to take the floor. Blessi is a member of the WHO Civil Society Task Force on TB. She is a health activist worldwide known with a background in community health and health system management, and is the CEO and co-founder of the Global Coalition of TB Activists and Touched by TB, the national coalition in India of people affected by TB. In India, she has led the civil society movement against TB. Blessi, we welcome your intervention.
Thank you very much, Dr. Teresa. Dr. Tedros, Director General, WHO, Dr. Mikhail Murashko, Honorable Minister of Health of the Russian Federation, Dr. Amina Mohammed, Deputy UN Secretary General, esteemed speakers, and audience joining from around the globe. Before I begin, I understand congratulations are in order. I would like to congratulate Dr. Tedros for being honored on the Times 100 Most Influential People list in the world. I'm honored to be bringing the civil society and community's perspective to this official UN General Assembly side event. I'm thankful to WHO for this opportunity. I'm a proud member of the WHO Civil Society Task Force, established under the guidance of Dr. Tedros, and in his words, recognizing the value of transformative power of civil society to drive change for impact. The Civil Society Task Force has many achievements and successful milestones, from high-level advocacy to providing technical assistance at country level and building capacities of civil societies and communities across the globe. Much as I would like to begin the Progress and Multisectoral Action session on a very happy note, the present global situation doesn't allow that. Of course, we have made great progress from the historical UN high-level meeting on TB and the ambitious and bold commitments made by world leaders in 2018. However, despite the hard work of many, progress is limited, and TB continues to be the biggest public health problem, with 10 million people falling ill and 1.4 million people dying due to TB in 2019 alone. The upcoming UNSG report is a good mirror of the situation. Added to this is the recent COVID crisis, which has changed the world and our lives completely. COVID has hit TB services, and we are in danger of being set back and all the gains being lost if we do not focus and bring the attention back to TB and safeguard the gains made until now. As we speak, we are looking at 400,000 additional TB deaths in 2020 alone, according to the Stop TB Modeling report. The recently launched Community's Perspective report of the Global Survey also highlighted many challenges at the ground level. In moving forward, we would like to highlight and place before you 3 points among the many that need urgent attention. Funding. Invest, invest, invest. TB funding has reduced significantly, especially in the past 6 to 8 months, while at the same time, billions of dollars have been made available for COVID. This is indeed great for COVID, but not at the cost of TB. We cannot turn away from TB, not now, not for anything else. TB remains the biggest killer even in COVID times. And as leaders, please do not shift your focus away from TB. We are only halfway through to filling the gap of $13 billion needed by 2022. Lives depend on it. Civil society and communities are ready to step into any gaps and support and guide investment decisions on how and where investments are most impactful and needed. Secondly, research. I heard recently that in the past 6 months, there have been more than 70,000 papers and 5,000 clinical trials for COVID. It's really amazing how countries have rallied around eliminating COVID. Similar energy, focus, and funds would enable us to hit the SDG goals and eliminate TB. Rapid research and new tools are urgently needed. Safer drugs, rapid shift to oral regimens, point-of-care diagnosis are still far away. In TB, we are moving at a snail's pace, and every minute delayed is 3 lives lost. Thirdly, accountability and support to countries. The health systems around the world are weak and ill-equipped to simultaneously respond to TB and COVID epidemics. Countries need to be supported to report data without fear of it being linked to sovereign ratings or punishment. Good quality and accurate data needs to be celebrated and supported. Presently, we celebrate disease elimination. But when we begin to celebrate data quality, disease will get eliminated with better use of funds. We have seen encouraging progress of multisectoral collaborations. For example, in Indonesia, the TB budget increased by 3-fold. Some progress is seen also in the ICA region. This re-emphasizes the value of meaningful engagement with civil society and community and must be fostered and actively practiced. The biggest barrier to our progress is stigma. And if we ignore, we run the risk of losing the gains. We ask you leaders to show the world your actions and stigma reduction. If we truly want to realize our collective dream of ending TB in the near future, we need to hold ourselves accountable to the commitments made and follow them up with wise actions, moving away from business as usual and moving towards a rights-based, people-centered actions. I would like to end with a quote from the great Mahatma Gandhi. And he said, "Recall the face of the poorest and the weakest person you have seen and ask yourself if the step you contemplate is going to be of any use to that person. Will the person gain anything by it? Will it restore him or her a control over their own life and destiny?" So today I call on you to picture the face of a TB patient when you take your next step. Thank you very much.
Thank you very much, Blissy, for your passionate and dedicated hard work, and as well as all your colleagues. You are really taking very close the pain and the hardships of people affected with TB as close as your own campaign. So I would like to thank once again all our keynote speakers for the opening session, and we are moving forward with our agenda. So we will have two sessions at this event. The first session will focus on country actions and progress. And we are very pleased to have high-level participation with the minister and other leaders joining us. The second session will be an interactive panel with heads of agencies and partners. I would like to start with setting the scene by sharing with you an overview of the findings in the 2020 Progress Report on Ending TB to the UN General Assembly. Here are a few highlights to provide context of the intervention that will follow from countries and partners. This progress report, as it was told by Director General Dr. Tedros, was requested by the member states, and it was requested to the Secretary General, and it was developed with the support of the World Health Organization. These last 5 years were very special for all TB community. We had ministerial commitments, we had high-level commitments from the heads of states. We have very ambitious targets in the political declaration and strong commitments based on the anti-TB strategy, pillars, principles, and targets. Here you can see the overview of the progress towards anti-TB strategy targets and targets set in the political declaration. 2020 is the year of a milestone of the anti-TB strategy, and we had targets to end TB to reduce TB incidence by 20%, to reduce TB deaths by 35%, and no one from TB patients and their families should face catastrophic costs. Yes, we've made progress, but progress is not enough. 9% decline in TB incidence, only 14% decline in reduction in TB mortality, and 49% less TB patients and their families facing catastrophic costs. And now let's look to the political declaration targets. Remind you, we've committed together to provide by timely and quality actions at least 40 million people with TB by 2022 and 30 million by TB preventive treatment for the same period. So yes, again, we can see the progress, but progress is not sufficient, and we should accelerate our efforts significantly to be sure that we will be able, despite of all our challenges, to do our best and to meet these targets. Another very important target, and it was highlighted by Blessy, funding is urgently needed. We committed that, and it was agreed that not less than 30 billion annually will be needed to really invest in progress, but we have 2 times less still. TB research and innovation area is also significantly underfunded. It was requested 2 billion per year, and as we can see and compare, it's not a big number, and it's possible to invest, and these innovations and their soonest implementation into the practice can become critical for the millions of people suffering. And now, finally, all our efforts and all the progress we've reached working closely together and with the communities, now it's under the risks, and if urgent and joint actions will not be undertaken, and we will not provide soonest recovery of the essential TB services, we can see further growth of TB incidence and death, and even this year it could grow up to 1.9 million. We should do our best and avoid this. Now I would like to attract your attention to the top 10 recommendations which you will find in the coming soon Secretary General Progress Report. Number 1, fully activate high-level leadership to urgently reduce TB deaths and drive multisectoral actions to end TB. urgently increase funding for essential TB services, including for the health workforce. Next, advance universal health coverage to ensure all people with TB have access to affordable quality care, and also resolve underreporting challenges as a part of the strengthening surveillance systems in the countries. Address the drug-resistant TB crisis to close persistent gaps in care. Number 5, dramatically scale up provision of TB preventive treatment. It can become critical, especially today during ongoing COVID-19 pandemic and crisis. We can prevent of development of TB, at least, if we cannot prevent sometimes development of COVID. Number 6, promote human rights and combat stigma and discrimination. Next, ensure meaningful engagement of civil society, communities, and people affected by TB. It is essential. Substantially increase investments in TB research to drive technological breakthrough and rapid uptake of innovations. In the 21st century, people should have access to the better, safer, and shorter treatment. And we are able to do this, and we should together do our best and invest and promote research and innovation. Ensure that TB prevention and care are safeguarded in the context of COVID-19 and other emerging threats. Request WHO to continue to provide global leadership to the TB response, working in close collaboration with the member states, stakeholders, including civil society. So our further discussion will be around these main recommendations, and I hope to hear commitments from the high-level officials, from the ministers, partners, and the civil society representatives. So we are moving to the session country progress and action. This is a very important session, and over the past years, as we've seen very impressive progress in the countries. And here we have representatives, high-level officials from the high-burden countries, and I would like to start from Nigeria. Nigeria, as you all know, is one of the top 5 high TB burden countries. However, much progress has been made in the country, notably through public-private partnerships to close gaps in care. Both His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria, and the First Lady, Her Excellency Aisha Buhari, joined the UN high-level meeting on TB in 2018 to commit to accelerate action to end TB in the country. We are honored to have with us today Honorable Excellency Osaji Ehanire, Federal Minister of Health from Nigeria. Thank you for joining us. Please share with us the strides your country is making to keep the promises at the UN high-level meeting.
Thank you for the introduction. Your Excellencies, the Deputy Secretary General of the UN, the Director General of World Health Assembly, Minister of Health of the Russian Federation, and the heads of agencies and civil society representatives here present. It is my pleasure to address Your Excellencies and participants at this side event on Nigeria's progress and initiatives towards achieving global targets to end tuberculosis. Nigeria has the highest burden of TB in Africa and the 5th highest globally. And we are also among the most affected by the COVID-19 pandemic in Africa. But we have made progress in TB control since the 2018 UN high-level meeting commitments, and we recorded 13% increase in TB notification in 2019, which was 77% of our target. We developed a plan to translate the commitments to action and mobilize domestic resources towards achieving the objectives, working with the Stop TB Partnership Nigeria, the Office of the First Lady of the Federal Republic, and wives of all the state governors who are our TB ambassadors to their states. and this brought more local resources for TB control. We are currently finalizing establishment of the Presidential Initiative to End TB in Nigeria, which is a multi-sectoral advocacy platform. Nigeria hosted a WHO-led joint UN high-level mission on non-communicable diseases and TB in February 2020, during which several government ministries came together on a multi-sectoral TB control platform. We have just conducted an end-of-term review of our TB National Strategic Plan of 2015 to 2020, with participation of various ministries and partners. The outcome of this will help us develop the new strategic plan with well-defined and identified roles for all stakeholders. The advent of COVID-19 pandemic and the control measures has impacted TB control gains that we made over the years, with a dip in TB notification, which may well affect overall TB notification in 2020. To address the impact of COVID-19 on TB programs, the Ministry of Health rolled out guidelines to advance the integration of TB case finding activities into the COVID-19 control measures and the primary healthcare system to ensure continuity of TB and other services during the pandemic. We collaborated with Global Fund to upgrade and engage some of the gene expert laboratories to provide both COVID-19 and TB diagnosis. The engagement of the regional governments also led to procurement of more gene expert machines, which now serve dual purposes. This has improved the infrastructure of our laboratories and ensures greater and more regular supply of personal protective equipment to health workers in the TB clinics. Ladies and gentlemen, we are committed to mobilizing resources to implement innovative strategies to end missing TB cases and to scale up services to all health facilities in our country. We intend to leverage on experiences gained from collaborating with partners, communities, and the private sector in our recent polio-free certification to support the response to an ending TB epidemic in Nigeria. I wish to recognize our partners, especially the Stop TB Partnership, USAID, WHO, and Global Fund for their support to our control efforts. We shall continue to work closely with you all to achieve the goal of ending TB in Nigeria. And I thank you for your kind attention.
Thank you very much, Your Excellency. I am now pleased to share the address of His Excellency Terawan Agus Putranto, Minister of Health, Indonesia. Indonesia is one of the pathfinding countries that has made remarkable progress in scaling up access to TB services, including through engagement with other sectors. The leadership of President Joko Widodo of Indonesia has been key. With him recently convened a high-level meeting in Jakarta to accelerate the elimination of tuberculosis. Investments in TB have also significantly increased. Here is the Honorable Minister's address.
His Excellency, Secretary General of the UN, His Excellency, Minister of Health of the Russian Federation, Director General of the WHO, distinguished delegate, ladies and gentlemen. It is an honor for me to be able to connect virtually with you all to re-emphasize our collective commitment to ending TB, a faceless and fractless enemy. Indonesia acknowledged that by 2025, the global TB fatality rate needs to be reduced to 6.5%, by which Indonesia commits to contribute toward the effort to reach the target. Our president has been strongly committed to ending TB. In this regard, there are several key points that I want to share with you all. First, we engage the world government and world society partner, particularly in the grassroots level, to accelerate TB case finding, to ensure that all TB care and service gain intersectoral support. During this pandemic, the grassroots level plays a crucial role in continuing the TB case finding in their community since 2017. This approach has increased our TB notification coverage that allow us to expand the treatment coverage that will lead to the mortality rate reduction. On the second quartile of this year, the mortality rate for TB has been 25% lower than the same period last year. Second, we put prevention measures at the center by involving the whole community element. We massively promote the preventive treatment for TB, guideline provision, training for health workers in primary health service facilities, and partnership with CSOs and social workers to provide preventive educational material to the community. And third, as a response toward the pandemic, we have significantly increased our investment to ensure the continuance of our TB care and service program. Our investment is directed to procure medicine and equipment, provide incentive for our healthy workers, and to provide additional support to those who are double affected by TB and COVID-19. Excellency, ladies and gentlemen, Indonesia is proud to be part of the global effort to ending TB, and therefore, let us not put down our effort to ending TB during this pandemic. Instead, we need to strengthen our collective effort. I believe that by emulating other countries' achievement, we can strengthen our effort and increase our positive attitude toward eliminating TB in Indonesia. Thank you.
I would like to thank His Excellency Minister for really strong commitments and real actions, putting these commitments in life. I'm now pleased to welcome the address from His Excellency Honorable Minister of Health Brazil, Eduardo Pazuello. And Brazil has been leading the way to combat TB through the route of universal health coverage. Excellent strides have been made, and we look forward to hearing the message from the Honorable Minister.
Senhores chefes de Estado e Governo, diretor-geral da Organização Mundial da Saúde, Dr. Tedros Adhanom, ministros e ministras de Estado, senhoras e senhores, bom dia. A tuberculose é a prioridade importante na agenda de saúde do Brasil. Temos empreendido esforços para combater essa doença infecciosa, que é a que mais mata no mundo. Apesar de o Brasil concentrar 1/3 dos casos da doença nas Américas, temos observado redução sensível na incidência e na mortalidade por tuberculose no país. Isso não é por acaso. Isso é fruto de muito trabalho de vigilância epidemiológica, de pesquisa e desenvolvimento e de atenção à saúde. No Brasil, a maior parte dos casos da doença está concentrada em populações vulneráveis. Destaco, em especial, a população privada de liberdade, pessoas vivendo com HIV, população indígena e pessoas em situação de rua. Nos últimos meses, em razão da pandemia da Covid-19, a situação agravou-se. Por conta disso, temos tido de readequar a resposta nacional. A Estratégia Nacional para Enfrentamento da Tuberculose já contempla ações multissetoriais. Desde 2012, com a formação da Frente Parlamentar de Tuberculose do Congresso Nacional, o Brasil vem colocando em prática estratégia integral de governo para enfrentar o desafio. Prova adicional disso é o Plano Nacional pelo Fim da Tuberculose, elaborado em 2017, em parceria com gestores estaduais e municipais, organizações da sociedade civil e representantes da academia. Mais recentemente, firmamos parceria com o Ministério da Cidadania para integrar os serviços de saúde e de assistência social em benefício do paciente infectado. Estamos também trabalhando com o Ministério da Justiça e da Segurança Pública para reforçar a prevenção e a atenção em saúde no sistema penitenciário. Outro desafio importante imposto pela Covid-19 diz respeito ao diagnóstico precoce de tuberculose. Políticas locais de quarentena, distanciamento social e medo de contágio impactaram negativamente a busca da população por atenção à saúde. Temos feito esforço importante para convencer a população a não esperar. Além disso, estamos reorganizando os serviços de saúde para retomar o atendimento primário necessário. Tenho orgulho de dizer que, mesmo com a crise global no setor produtivo, por conta do coronavírus, a oferta de tratamento contra a tuberculose no Brasil foi garantida com a aquisição emergencial dos principais medicamentos, em doses fixas combinadas para o tratamento da doença. Além disso, vimos investindo fortemente nos últimos anos em pesquisa e desenvolvimento de novos testes diagnósticos e de novas alternativas terapêuticas. Não posso deixar de destacar, por fim, as atividades de cooperação internacional, que também são essenciais para enfrentar a doença. Participamos da iniciativa Report TB, juntamente com os Estados Unidos, para a estruturação de grande repositório de amostras biológicas relacionadas à doença. No âmbito da rede de pesquisa em tuberculose dos BRICS, o Brasil tem financiado pesquisa para desenvolvimento de métodos inovadores para tratamento e diagnóstico da doença. Em 2019, durante a presidência pró-tempore brasileira do BRICS, lançamos edital no valor de $4 milhões para novas tecnologias de combate à doença. Em 2020, lançamos novo edital para pesquisa sobre co-infecção entre Covid-19 e tuberculose, com um novo financiamento brasileiro de $1,5 milhão. Senhoras e senhores, as ações do Brasil de combate à tuberculose são significativas e continuadas, pois refletem a prioridade que damos ao tema. Agradeço a oportunidade de dialogar e de aprender com a experiência de outros países sobre como dar seguimento a essas ações num contexto de pandemia global. Juntos, conseguiremos estabelecer novas metas e criar resposta integrada, criativa e eficaz contra a tuberculose para o bem-estar de todos. Muito obrigado.
Thank you very much, Your Excellency, for your commitments and hard work. India, as you know, all bears the highest TB burden in the world. However, much progress has been made in the country, notably through commitments at the highest level by Honorable Prime Minister Modi. Innovative approaches, including digital technologies and public-private partnerships, have been vital to close gaps in care. I am pleased today to share with you the address by His Excellency Honorable Minister of Health and Family Welfare, India, Harsh Vardhan.
Distinguished members of the United Nations and World Health Organization, excellencies and ministerial colleagues of member nations, tuberculosis has been in existence since time immemorial and continues to remain a major global public health problem. Despite the progress made over the last decade, TB remains the leading infectious killer disease worldwide. In India, under the guidance of our Honorable Prime Minister, Shri Narendra Modi, India has accorded high priority for ending tuberculosis by 2025, 5 years ahead of the Sustainable Development Goals. We are all witness to a massive social re-engineering that is taking place globally. The COVID-19 pandemic has brought in dramatic shifts in our lives in more ways than one. The public discourse on health has now taken the center stage. There is heightened public health awareness among the public today. I would say that the COVID-19 pandemic has given us the opportunity to structurally reimagine our core public health delivery systems. Innovations such as doorstep delivery of drugs to TB patients, teleconsultation, active screening for TB through outreach activities, etc. have proved to be a boon for many patients during the lockdown. With bold and innovative policies supported by commensurate resources, India has taken several critical steps towards ending tuberculosis. We have significantly reduced the number of missing tuberculosis patients from 1 million in 2016 to less than 0.5 million in 2019, with 2.4 million cases notified during the year. More importantly, a third of these notifications were contributed by the private sector. Poverty is a powerful determinant of tuberculosis and undernutrition, an important risk factor of developing active TB disease. To address this, we are providing cash incentives for nutritional support, and since April 2018, around $110 million has been distributed to over 3 million beneficiaries. We all know that the onset of the pandemic has resulted in setbacks to case finding efforts during the lockdown period. But as soon as it was lifted, case finding numbers have started rising. In fact, we reached a historic low in the month of April with lockdown in full force. But through sustained efforts, we have managed an increase of 43% in May and another 25% in June. As we gradually unlock the country, we will be back in full gear. To mitigate the impact, we have been issuing constant advisories to the states to ensure convergence of TB case finding.
Dear colleagues, I would like to apologize for some technical problems, and would like once again sincerely thank His Excellency Minister for showing this excellent example of the continuing fight against TB for people's lives. And it's really a very inspiring example for the whole world. Vietnam is also among the highest TB burden countries, but also a pathfinder in innovations to end TB. The recent example shared by this country is with the setting of a multisectoral accountability commission focused to provide really comprehensive response and follow the recommendations and the commitments of the political declaration and TB strategy. We are pleased to have an address from Professor Tran Van Tuan, Vice Minister of Health from Vietnam. Your Excellency, floor is yours.
Mr. President, on behalf of the Ministry of Health of Vietnam, I would like to send my warmest greeting to the President and all senior leaders of member states at the conference. Mr. President, tuberculosis remains the leading infectious killer worldwide, and unfortunately, COVID-19 pandemic currently is the biggest problem for public health in the nation and negative impact to TB control. Vietnam strongly supports the political declaration that has been made by head of state in the first ever UN high-level meeting on TB in December 2018. In that, multi-sectoral actions are most important. The core of this declaration is a multi-sectoral accountability framework that developed by WHO and partners, including commitment, action, monitoring, and reporting and evaluation. In other words, we need to mobilize the whole political system and community into action It is also applied to COVID-19 responding in Vietnam. Through that, in 2019, the Prime Minister established the National Commission on Ending Tuberculosis, chaired by Deputy Prime Minister Vũ Đức Đam, and with the participation of representatives of all ministry and sector related to TB control to make strong intervention focused on tasks set by Central Party the solution to end TB by 2030 and mobilizing all resources, including health insurance, private sector, for optimizing TB control. The first meeting of the Commission has issued 26 interventions implementing in the 2020. We are now implementing the national strategy for TB control to 2020 with vision 2030 approved by the Prime Minister and the National Strategic Plan 2021-2021 along with the National Action Program to end TB by 2030. Based on this approach, we get involved almost sector in action from central and local authority and society to increase domestic resources awareness of community and strengthening TB network. We also use TB network for COVID-19 response that make positive impact towards disease control. By doing that, we have got support from international partners, especially Global Fund, which had already committed to fund $66 million for NTB plan of Vietnam in next 3 years. We have also got strong support from WHO, CDC, and other technical partners. By this occasion, on behalf of the Ministry of Health of Vietnam, I would like to recommit to the global anti-TB strategy and express my sincere thanks to all partners for effective support to Vietnam to implement anti-TB strategy and control COVID-19 as well. Thank you very much.
I would like to thank all the amazing speakers of the previous panel and would propose to move to another panel. This panel will put the spotlight on partners' agency contributions towards sustaining and strengthening progress towards ending TB, which is especially important, of course, in the context of the COVID-19 crisis. And my first speaker will be Dr. Lucica Ditiu, Executive Director of the Stop TB Partnership. Please, Lucica, highlight the partnership's role in driving multisectoral action and progress to reach global TB targets, and probably you will make special focus on the role of community and civil society.
Yeah, so thank you very much, Teresa, and I would like to really use this opportunity to thank all your team, yourself, and obviously the entire for putting this meeting together, and to thank as well the Russian Federation and Mission to co-organize this event. I think we all remember very well how we were 2 years ago, right? Several people in the panel today are those amongst that spoke 2 years ago, and the energy and the passion, the hope that we were having at that time. And as we know, we managed to have an amazing political declaration and great targets. And I want to say that we were doing pretty well in achieving these targets. COVID came and pushed us back, I would say, and as we could see from all the modeling done by Stop TB, by WHO, due to the fact that we still see a decrease even now in September. We didn't come back to the levels of notification as they should have been. We are in a very difficult situation. I would say that we are rolled back. And I would say that I think 2020 is lost in terms of observing an increase in the number of people with TB diagnosed. So 2021 and 2022 will be crucial if we really want to get close to the targets. Monitoring numerically all these targets, and I know that the UNSG report will be released a bit later, will be extremely important. We need to see, we have the targets unpacked per country, so we need to see how quickly we can, I would say, in TB bounce back, and how in the coming months and in the coming 2 years. And that's why I want to say three things from the Stop TB partnership side. I will leave the community and civil society as the last, because that's, in my opinion, the center of all of it. The first one is we need to ensure that we continue. I'm very pleased to see the political commitment, the Honorable Minister of Health of Nigeria being with us live, the Honorable Minister of Health of Russia as a host staying with us live. This is great commitment, and we need to ensure that we continue the pressure at the level of heads of states and governments, as you said. So from the Stop TB partnership side, we will continue doing the political advocacy that we are very familiar with, together with, of course, all of you, and together with all the partners, because indeed, if we have countries like India, Indonesia, Pakistan, the Philippines, Nigeria, South Africa, Russia, obviously in the driving seat, we will be able to hopefully have a sort of peer pressure to other heads of states and governments to continue this support and to ensure that we are achieving the target. The second point that I want to make is this. COVID, we don't have, I think we naively thought, at least in April, May, that COVID will pass. COVID is here to stay, and I think unfortunately will be here to stay several more months, I would say that even 2021 work will be heavily impacted throughout the year by COVID. And that's why we need to be smart. And we need to do things in such a way that is not one or the other, because the poor ministers of health will be pulled from one direction to another. Is it TB? Is it COVID? Oh my God, is HIV? Oh my God, is malaria or other disease? We have to look at it in a comprehensive manner. And I want to say that several people said, let's use the COVID as an opportunity to raise the TB profile. Yes, and Blessy spoke about the efforts that everyone are putting into getting COVID data and information out there. But I want to say that actually COVID is using a lot of the TB work, and actually COVID, TB is an opportunity for COVID efforts, as we know very well, both being airborne diseases, both, you know, the measures that we were taking and implementing for TB at country level can be leveraged for COVID as well, going from the, you know, infection control, going from the, as well, the way in which we are promoting digital technology and artificial intelligence, adherence treatment that can be done online these days, X-rays that can be done with portable machines, and as well with artificial intelligence, ensuring that the mobile units that we had for TB diagnosis can do as well COVID diagnosis, and as well, the entire capacity we built and the work that we did on civil society and communities. And this is my third and a very important point. We will not achieve anything if we are not genuine about making sure that the TB response is centered on respecting the rights of the people, in ensuring that the programs are not, are properly crafted, in being gender sensitive, and looking at all the problems that key groups, vulnerable groups, and key populations in accessing the services. But this is not specific for TB. And the ones that are usually affected, like even now for COVID, the first ones that are affected are the most vulnerable. We need to use the networks that, and we in Stop TB did a lot of work to create amazing networks, to support amazing networks at country level, at regional, and at global level, as well as a very solid Stop TB partnership civil society constituency that embrace people, not only to give the voice in meetings and in, you know, in gatherings, but to be very active participants to the TB programs and the TB response at the country level, implementation, but also monitoring. I think I am done with the time. I imagine that's what was said. I just want to say that we have 2 years to catch up what we lost, because we were doing something, we were on track, but this year we were completely upside down. Unless we buckle up and we stay shoulder to shoulder, we will and understand that is not TB or COVID. It is, unfortunately, in the current time, using the TB platforms addressing COVID. And I also hope that we will all together see each other in 2023 at the next UN high-level meeting on tuberculosis. And I don't think we should accept anything less than that. Thank you very much.
Thank you very much, Luchika, for your, as usual, strong, concrete, and reasonable points. And thank you for your hard work and collaboration. With this, I would like to move to another very important speaker, the Executive Director of the Global Fund, Peter Sands. Global Fund is the top implementational donor financing TB efforts globally, especially in low and middle income countries. Please, Peter, share with us Global Fund perspectives on strengthening financing and resource mobilization to end TB and advance progress even in this very challenging time, including in the context of COVID-19. Please.
Thank you, Teresa, and thank you to Your Excellencies and partners for inviting us to participate and for your partnership here. The Global Fund, as you say, is the largest external funder of TB programs. We provide 73% of international funding for TB and have invested 7.2 billion in the fight against TB up to June 2020. I want to tell you a good news, bad news, and very bad news story, and then a light at the end of the tunnel. The good news is, reflect back, it feels like ancient history right now, is what it felt like right at the beginning of 2020. Actually, in the TB world, there was a sense of new confidence and excitement. The energy unleashed by the high-level meeting had translated into some real tangible progress on reducing the number of missing people with TB, on getting better rollout of new MDR TB programs. We were seeing much more assertive and coordinated action by civil society on the human rights issues around TB. There were some very good things happening. And from a Global Fund perspective, following our very successful replenishment, we were looking at being able to increase funding for DP by nearly a quarter, by 23.4%. But then COVID happened. But even before that, the bad news. The bad news was that even with the progress we were making, we weren't making fast enough progress. Yes, we had accelerated the trajectories following the high-level meeting, but there was still a huge amount to do on TB, and we still have the situation where 1.4 million people are dying of this disease. The doubly bad news, of course, is COVID, and COVID has been enormously disruptive. 75% of the Global Fund's TB programs across the world have been disrupted by COVID or the public health measures in response. So what do we need to do? Well, the first thing actually is something that we have done as a community. And I think many of the countries represented here, many of the partners, many of the civil society groups should actually feel quite proud, because when COVID first hit and we looked at some of the numbers about what could happen and the scale of the disruption, it was very, very bleak indeed. I'm not saying it's not bad now. It is still bad and extremely challenging. But actually there was a very coordinated, intense response to ensure people on treatment kept on treatment, to try and preserve identification diagnostic programs. The Honorable Minister of Nigeria talked about expanding capacity of labs, of getting new diagnostic machines so that we could be using them both for COVID and for TB. For our part, the Global Fund sought to play its role in supporting these immediate responses by making money available and available flexibly and quickly. And through a couple of mechanisms we launched, first in early March, second in early April, we've made over 730 million and more still to be delivered. However, this is not going to be enough. This is enough to help the immediate response, but it's not going to be enough to get back the ground we have lost and to sustain the response in, as Luchika said, a sustained pandemic. COVID is not going away quickly. And so we have to adapt to our TB programs, treatment, identification, all elements of TB programs, to a world in which we are still fighting COVID. That takes money. The Global Fund reckons we need an extra 5 billion on top of the money we have already to help mitigate the impact on countries affected by HIV, TB, and malaria of the COVID-19 pandemic. And that 5 is part of the broader ask of 38 billion that the Access to COVID Tools Accelerator has put forward. I also think we need to keep our ambition. We can't get into a mode of just sort of minimizing the negative, of trying to minimize the damage. Actually, in the Global Fund, we're keeping our targets. We want to stay committed to doing what the UN high-level meeting said we would do. And it was great to hear the ministers from the various countries talking in the same spirit about sustaining that level of commitment. We owe it to the millions of people suffering from TB to keep that commitment. And then I also think we need to play our part, the TB community, in defeating COVID-19 and ensure we don't end up in a situation where COVID-19 joins the list of pandemics for whom we have an unfinished fight. HIV, TB, they were once the big pandemics sweeping the world. In the rich countries, they have been largely eliminated as public health threats, but we know all too well how many people they still kill, how many lives and families and communities they destroy elsewhere in the world. We don't want COVID-19 to be another one of these unfinished fights. In fact, we should turn the logic on its head and use the energy and the focus on infectious disease that's been unleashed by COVID-19 to say, not only should we finish the fight against COVID-19, but while we're about it, and because we can, let's finish the fights against HIV, TB, and malaria, and get those done too. Thank you.
Very much, Peter. Can't agree more with all your points, and special thanks for your fast, innovative, and very agile approach. In current situation during pandemic is becoming critical, and thank you for the true partnership and effective partnership. It's very important, not only investments, but also these good examples of effective working models are also critical. I would like to thank for joining us today Dr. Alma Golden, Assistant Administrator for Global Health from US Agency for International Development. USAID is the biggest bilateral funder of TB efforts worldwide and to WHO work on TB. USAID leads the US government's global TB efforts by working with agencies and partners around the world to reach every person with the disease, cure those who need the treatment, and prevent the spread of new infections and the progression to active TB disease. USAID's new TB model, the Global Accelerator to End TB, has also been instrumental in driving progress. Please share with us your vision on the current situation and what we can do better to accelerate progress towards ending TB.
Thank you so much. It is an honor for you to be invited to speak today. I want to extend my greetings to our distinguished experts, to the fellow panelists, and also to the ministers of health around the world. Thank you for the invitation to the United States Agency for International Development, USAID. I am Alma Golden, the Assistant Administrator for the Bureau for Global Health. USAID leads the US government's global TB efforts by working with agencies inside the US government and outside, and partners around the world to reach every person with TB, cure those in need, and prevent the spread of new infections. We look forward to the UN Secretary's report and the 2020 progress from the high-level meetings. Many of you may remember 2 years ago at the at the United Nations high-level meeting on ending TB that the USAID launched the Global Accept State from high TB burden countries, as well as our partners. We committed to reaching the ambitious target goals with the accelerator. That is our business model, to help countries commit and develop capacity to reach those targets. We designed this TB accelerator to increase the investment, work with local communities, and partner to deliver performance-based results based on the global targets that were adopted. The accelerator remains increasingly relevant because it strengthens local institutions and it promotes systemic changes in the health sector. Both are crucial to the countries maintaining progress to date with addressing TB. One example is in Uganda. Their TB prevalence survey showed more cases than previously they had anticipated. USAID signed a partnership agreement with the Ministry of Health to strengthen the efforts to find the undiagnosed TB cases. We worked hand in hand with the National TB and Leprosy Program, and this joint effort contributed to an overall increase in TB case detection from 60% in 2018 to 80% in 2019. The accelerator's approach prioritizes building strong and sustainable local institutions, which are the on-the-ground and more readily available resource to help countries with TB responses. Now, more than ever, these local partners have been particularly important in supporting the continuation of services through the COVID-19 pandemic. As you know, many of these countries and their health facilities and other institutions were shut down. And in order to reach the goals and to reach the people in need, other resources needed to be identified. One example is in Indonesia. USAID partners with one of the country's largest faith-based organizations, Muhammadiyah, with a network of over 400 health facilities. This local partner has been able to establish special areas within its facilities to continue to safely care for drug-resistant TB patients, as well as to add healthcare services for COVID-19. It has also connected facilities to private donations for special things such as hand sanitizer and other concerns that have been raised with COVID as well as with TB. And in the Kyrgyz Republic, when transportation shutdowns and restrictions of movement threatened to have TB patients isolated, USAID's partner, the National Red Crescent Society, tapped into its network of nurses to ensure that TB patients' treatments, adherence, and follow-up continue. While these local partners have stepped up and demonstrated remarkable capacity, the reality is that COVID-19 and its mitigation efforts are impacting TB services, as mentioned by Dr. Sands, and could significantly, diseases are impacted by the effects of COVID-19. TB carries additional complexities, sort of a snowball effect, because of the problem of untreated cases, the risk of increasing drug resistance, the comorbidities that may occur with COVID-19, and the increased chance of transmission and difficulties with prevention, and also just the stigma of TB and symptoms similar to TB. As many of you know, the recent modeling study that was commissioned by Stop TB Partnership showed that 5 to 8 years of progress may be lost, and an additional 1.4 million lives could be lost in the next 5 years, secondary to some of the problems that we've had related to COVID. Given this prospect, USAID is eager to do our part in getting the world back on track for these setbacks, and then further accelerate progress toward reaching the UNGA targets, much as what you heard from Dr. Sands and others today, the need to actually identify where we are, recover, and move forward. With this challenge facing the world, the accelerator approach increases coordination, leverages additional resources, and develops effective interventions. And this is more important than ever. The opportunity to work with private sector, public sector, and local groups, such as these faith-based groups that we've identified, are really important. As we cannot do business as usual. But however, as you heard from previous speakers, this is an opportunity that we can use the energy, the innovation, and the partnerships that we're developing around COVID to really improve our responses also to TB. USAID is committed to continuing our efforts to addressing tuberculosis and to ending TB around the world. We thank you for your partnership and your wonderful efforts as well. Thank you.
Thank you very much, Dr. Golden, for your very important highlights, strong commitments. And indeed, support from the US government to the high burden countries is vital, and we can clearly show the results from the examples you've shared. And we also acknowledge our cooperation, partnerships, and hope for its continuation. We are talking more and more frequently and highlighting the importance of the multisectoral engagement and measures. And it's clear when we're analyzing the progress that without meaningful engagement of other sectors, progress, especially in these current circumstances, will be extremely difficult. I would like now with this give floor to Lord Herbert of South Downs. He is the founder of the Global TB Caucus and has been involved globally in the fight against TB for nearly a decade. He is a member of the House of Lords in the United Kingdom Parliament. And I would like to ask Unique to share with us your insights of the important role of parliamentarians in the global fight against TB. And please, will be interesting to know more about your perspectives and the actions we should do urgently.
Well, thank you very much, Teresa, and it's a great honor to join such distinguished company in this meeting today. I'm speaking to you from the UK Parliament, and I'm very pleased to have the opportunity to reiterate the important role of parliamentarians at the time and in the situation that we find ourselves in. I was there at the high-level meeting 2 years ago. We were full of hope and ambition, but I want to underline a key point that I thought was made by Peter Sands, which is that even if COVID had not intervened, we would still be off target. And we would still be needing a meeting like this in order to talk about why and how we could get ourselves back on targets that were themselves targets in order to ensure that we ultimately met the Sustainable Development Goal of beating the disease by 2030. And the truth is that because of COVID and because we weren't sufficiently on target anyway, the high-level meeting that set out a program of action that was intended to accelerate progress back towards meeting the Sustainable Development Goal has, in fact, resulted in a deceleration over the last year. That's the truth. And so we would be looking anyway at 8 million lives, around 8 million being lost by the time of this target being met in 2030 to beat the disease, even if we were going to meet it, 8 million lives. In fact, it looks like there are going to be many more lives lost, and we are completely off the trajectory that we need to be on. And it's worth us just reminding that this is year D-10. We are now on a countdown to the decade over which the Sustainable Development Goals and Goal 3.3 to beat this epidemic, to beat it, has got to be met. So I don't think we want to be, in spite of celebrating the progress, in spite of celebrating all the efforts that are being made to try and deal and counteract with the impact that COVID has had. I don't think we want to be under any illusion about the scale of challenge that confronts us and about the humanitarian toll of failing to do so. And that is indeed a very important message that we need to take to the parliaments of the world. I want to just draw out three elements from the report and the declaration. And the first is the need for leadership. And that leadership must extend, I think, to political leadership at the highest level. And in turn, I believe that members of parliament will have a very important role in making the case for action. Frankly, members of parliament's attention has been massively diverted over the last year, the last 6 months. That's not surprising. Politicians across the world are burdened and troubled by the impact of COVID, and they're worried not just by the fact that it's a disease that can cause suffering and death, but by the economic toll that it's exacting on their countries because of lockdown measures. It is going to be very hard to get the attention of politicians on TB now. And to do that, we do need very clear messaging to demonstrate that actually there will be a massive cost if we do not restore the direction and momentum towards beating TB. More lives lost than we could conceive at the moment will be lost from COVID. And we need also, I think, as well as being fully cognizant of the very great damage to TB programs that's been done by the redirection of resources, for instance, in research and development, we also need to see that there is an opportunity which we need to communicate to political leaders that actually in future, global health security will become more important, that they should be worried about surveillance, they should be worried about the ability to monitor, to diagnose, and then to treat these diseases, and they should be interested in putting in place the systems which can do so. So while TB is definitely, the battle against TB is definitely a victim at the moment, hopefully in future, we can be part of a global determination to better prepare ourselves for these pandemics. Two other points. Firstly, on funding, I just want to reiterate the points that have been made about the need for funding and to back up what Peter Sands said, the need to ensure that our politicians remain committed to mobilize resources for the global fund as well as in country. We will have a tough battle in arguing for the replenishment of the global fund next time, and we must be willing to make that case as well as for the short-term case for the $5 million commitment that's necessary in order to allow the global fund to mount its COVID resilience programs. Lastly, on the issue of accountability, that was a piece that I argued at the time, and so did Bill Gates, by the way, was missing from the high-level meeting declaration. Yes, there is a multi-sectoral accountability framework, but when I talk about accountability, I mean the very sharp accountability that political leaders need to feel if we collectively do not meet these targets, and that has to be at the highest level. And so I do think that we should be campaigning for a proper, dedicated, high-level meeting in 2023 to review the progress that we have made on TB, not bound up as part of some other broader health consideration, but on tuberculosis, because this is and remains the world's deadliest disease and the biggest killer. And we must make that point. And the UN has a responsibility as the architect of the Sustainable Development Goals. The UN has a responsibility to ensure that that meeting can be held at the highest level, and we cannot allow anyone to suggest that there should be any kind of demotion of that. Parliamentarians will continue to play our role. We've argued for increased budgets successfully in many countries. We've updated TB laws in others. We've launched our 54th National TB Caucus in Pakistan during the lockdown. We have a meeting tomorrow in the Americas region to talk about accountability. So we know we have a a role to play, and we will continue to be as strong as voice as we can around the world in our parliaments to say that we must not lose sight of the importance of beating this disease. Thank you.
Lord Herbert, thank you very much for your leadership. And we can see from very clear examples from the countries, high burden countries, how parliamentarians can play critical role. I will give just two of them. In Philippines, parliamentarians introduced special TB law, which contributed a lot into the progress. Another recent example, caucus was established during this COVID pandemic, TB caucus in Pakistan. And this is extremely important, not to lose focus on TB even during the biggest pandemic in the world. So, and of course, we are all requesting, and it was highlighted in the political declaration and now in the progress report, that 2023 high-level meeting with a comprehensive review of the progress will be clear example of an accountability, a high-level accountability and accountability of all the stakeholders and partners. I now would like to turn to Dr. Philippe Duneton, Acting Executive Director of Unitaid. Unitaid is leading efforts on innovations to end TB and supporting really very critical projects which allow us to provide better treatment options and access to the child-friendly formulations, for example, for children, and improve our diagnostics and introduce as fast as possible new regimes for the treatment of patients with MDR-TB. We're very proud of our collaboration, and I would like to ask Dr. Duneton to share with us your vision on the current situation and what will be critical to provide progress towards ending TB and not to lose our focus.
Thank you, Teresa, and thanks for the permanent mission of Russia Federation to organize this meeting. I think it's important. Thanks again, Teresa, for you and your team for your commitment. I think a lot have been said, and I think that the first point I want to make is we share, as Unitaid, the concern that was expressed in fighting TB, the importance of the fight, but also the current situation. So I will not repeat. And I think that I just want to maybe highlight maybe a potential good news among the bad news that we have seen. And again, it's to reinforce the commitment we have as Unitaid, but also with the partners and colleagues around the world and around this table today. And one thing that's quite important is the fact that we share the same challenges that we are facing. And I think that it's very clear where we are, and it's very important that we can communicate to the rest of the world where we are in TB and the challenge specifically that is put in front of us with the COVID-19. And we know by experience, unfortunately, that the most people in need, I'm thinking of course the people affected by TB, but the co-infection with HIV, and the fact that it's the most vulnerable people who are affected and also be affected by the situation of COVID-19 for all the reasons that was discussed previously. So this obviously is the bad news. The good news is that we have a common vision and commitment. And I want to specifically highlight the role of potential role of innovation. It was mentioned by Lucica at the beginning. I think that we need to recognize also that was the case previously the COVID-19 situation, that innovation is key in TB. And we have seen and pushed more innovation over the last 5 years than in the previous 60 years. And this is important, and this has the potential to help also facing that crisis. As you know, Unitaid has invested a lot into that, but it's not in isolation. It's really working with the Global Fund, with USAID and the countries to make sure that the new tools can make a difference. Maybe just to think about it, and I think it's something that we need to have in mind, the potential innovation is around simplification, acceleration, and transformation. And just have a very small example, the fact that we now have pediatric formulation for sensitive TB, but we are working on new formulation for MDR. We have new regimen in MDR TB, and easier to use diagnostic is something that has a lot of potential impact. The fact that we can also accelerate the uptake of shorter therapy, for example, prevention of TB among the people living with HIV, but also potentially the contact case in the future is something that has really a potential to shape and course correct the situation that we have been describing. And more importantly, I think that we need to think about the transformation. Transformation in the way people get access to the treatment or diagnostic, transformation in the way that people can effectively follow up their therapy and using, for example, development of digital technology and maybe other type of technology that was alluded to by Luchika in terms of diagnostic, for example. So finding, developing, and scaling up innovation is even now more critical than ever if we can think that we can bend the curve. And already the step is in front of us is huge. So again, political commitment, of course, resource is key at international level and domestic level, but also articulation with the program, integrating and scaling up innovation will be key. It was the case before, it's even, again, more important now. Thanks, Teresa, and all the colleagues.
Thank you very much, Philippe. And you've highlighted once again the importance of innovation. It's really critical, especially in this time. And we see clearly that thanks to our coordinated and joint work, we were able to introduce new regimens for the treatment of patients with MDR-TB, fully oral regimen. And now it's becoming the only one option in the situation with the lockdowns. And many countries are adapting and implementing this regimen. It's becoming essential and critical in the current circumstances, as well as TB preventive treatment. Now we have more options, and we should prevent those who are at risk of development of TB. So very, very important way, and I hope that we will continue. In fact, we have a lot of challenges and issues, but we may see as, if we may call it as positive side effects of this situation, strengthen collaboration among the partners within TB community. And I hope that we will continue. Definitely, this is the only one possible way to overcome crisis, both COVID and TB. Dear colleagues, I would like to propose you and would like to share with you once again address by His Excellency Honorable Harsh Vardhan, Minister of Health and Family Welfare from India. India is one of the biggest, as I told, countries with TB burden, and they've done a lot under the leadership of the Prime Minister. And let's listen once again to the very important points raised in the speech of His Excellency.
Members of the United Nations and World Health Organization, Excellencies and ministerial colleagues of member nations, tuberculosis has been in existence since time immemorial and continues to remain a major global public health problem. Despite the progress made over the last decade, TB remains the leading infectious killer disease worldwide. In India, under the guidance of our Honorable Prime Minister, Shri Narendra Modi, India has accorded high priority for ending tuberculosis by 2025, 5 years ahead of the Sustainable Development Goals. We are all witness to a massive social re-engineering that is taking place globally. The COVID-19 pandemic has brought in dramatic shifts in our lives in more ways than one. the public discourse on health has now taken the center stage. There is heightened public health awareness among the public today. I would say that the COVID-19 pandemic has given us the opportunity to structurally reimagine our core public health delivery systems. Innovations such as doorstep delivery of drugs to TB patients, teleconsultation, active screening for TB through outreach activities, etc., have proved to be a boon for many patients during the lockdown. With bold and innovative policies supported by commensurate resources, India has taken several critical steps towards ending tuberculosis. We have significantly reduced the number of missing tuberculosis patients from 1 million in 2016 to less than 0.5 million in 2019, with 2.4 million cases notified during the year. More importantly, a third of these notifications were contributed by the private sector. Poverty is a powerful determinant of tuberculosis and undernutrition, an important risk factor of developing active TB disease. To address this, we are providing cash incentives for nutritional support, and since April 2018, around $110 million has been distributed to over 3 million beneficiaries. We all know that the onset of the pandemic has resulted in setbacks to case finding efforts during the lockdown period. But as soon as it was lifted, case finding numbers have started rising. In fact, we reached a historic low in the month of April with lockdown in full force. But through sustained efforts, we have managed an increase of 43% in May and another 25% in June. As we gradually unlock the country, we will be back in full gear. To mitigate the impact, we have been issuing constant advisories to the states to ensure convergence of TB case finding with COVID-19 efforts. We have initiated bi-directional screening among TB and COVID patients and screening for TB among ILI and SARI cases. Through a program of strategized advocacy, securing societal and political commitment, thought leadership, disruptive social entrepreneurship, and creating powerful partners, we are trying our best to fire the imagination of people and drive a mass movement to win this war against the killer disease. To seek citizen support in this drive to eliminate tuberculosis, we are involving global and national philanthropic organizations who will help us to minutely monitor the progress of the government programs and also reach powerful public action campaigns to the remotest districts of the country. I can assure you that my government has accorded topmost priority to TB elimination. India is willing to develop networks and collaborations to enact real change and learn from similar global experiments elsewhere in the world. I am confident that with the support of all stakeholders and through collaborations as well as sharing of best practices, we will be able to realize our determination of ending tuberculosis by 2025. I thank you for giving me this opportunity to address this enlightened audience.
It's great that we were able to hear these really excellent examples of actions which are contributing into the sustainability and continued fight against TB in India. Dear colleagues, our event is coming to the end, and it was very rich discussion. Thank you all for prioritizing in your very busy agenda this event. We are receiving a lot of questions in the Q&A section, and my colleagues, experts from the Global TB Program, are trying to respond to them. Of course, we will provide also, if you share your contact details, further comments and responses to your questions. It's very important to be well communicating, to be aware and about the most critical issues which are happening. I would like also to pay your attention and to refer you to WHO official website and our TB program page where you can find additional information, because I see there is a lot of questions on TB and COVID. We are developing and updating regularly information note on TB and COVID. And also you can find other useful information like compendium of latest research activities on TB and COVID, and overview of the recent publications. We will keep you informed and we will keep you guiding based on the evidence and the monitoring, where do we continuing, and also more information will come with our global TB report in October. And I would like to thank all the countries. We've received data and information for the global report from more than 200 countries. Even in this very busy time, you've prioritized, and it's very important to be aware, to understand the current situation, and to act and to move in the right direction. Thank you very much once again. We will continue working closely with you. It's critical to stay joined and to be together in the current circumstances. I am now pleased to invite Dr. Renin Gui, WHO Assistant Director General for UHC, Communicable and Non-Communicable Diseases. He leads the division the Global TB Program is housed under, and champions anti-TB efforts with unwavering support. Dr. Ren, would appreciate your closing this important event.
Thank you, Teresa. Excellencies, distinguished guests, dear colleagues and friends. Today's discussion and dialogue, and this is very important, the United Nations General Assembly side event on TB, has been very inspiring and important as we plan critical next steps. It's heartening to see so many countries and partners, especially those at this event, moving forward in accelerating actions towards reaching the targets of United Nations high-level meeting and in building greater accountability. As we also hear from previous speakers, many should and could be done. Tuberculosis is the world's greatest infectious disease killer, providing a prime example why we need to work together with such urgency across sectors towards a universal health coverage, particularly for the most poor and vulnerable populations worldwide. This is even more critical in times of crisis, such as COVID-19 pandemic. We need to keep our foot on the pedal by implementing the priority actions outlined in the United Nations Secretary General Progress Report on ending TB. The health of millions of people and their families rest in our hands. It is huge responsibilities. We cannot let them down. By working together and showing joint leadership across efforts to achieve the universal health coverage and ending TB, we can ensure adequate care for those most in need and the most vulnerable. Together, we can ensure no one is left behind. I would like to thank the Russia Federation for hosting this event with us, and also our distinguished speakers and panelists, and you, our wonderful audience, for joining us in keeping the spotlight on ending TB. We need to keep our promise. It is not the moment to lose. Together, we can and will make difference. It's time for action. It's time to end TB. Thank you very much.
Thank you very much, dear colleagues.